الرحمن الرحيم إنا أعطيناك الكوثر فصل لربك وانحر إن شانئك هو الأبتر صدق الله العظيم. Everybody read Durood Sharif once. Allahumma salli.
Jazakallah, Dr. Habib. Assalamu alaikum to everybody who's joining us slightly late, and apologies for ourselves running a few minutes late. As I mentioned previously, we are going to be discussing the reopening of the madrassas safely in Scotland. We have Brother Omar Afzal, who is the head of mosques and communities for the Muslim Council of Scotland. Many of you will know Omar from discussions you've had with him or from his television interviews or his video interviews. He's a bit of a celebrity to many of us. He will give us a brief or background on the context of COVID-19 at the moment and where we are at the moment in terms of COVID-19. And then he will go on and discuss the health and safety advice and what is necessary for a madrassah to reopen again in Scotland. So I'll pass over to Brother Omar to give us a bit of background on what's happening at the moment in terms of COVID-19. Assalamu alaikum, Brother Omar.
Wa alaikum assalam.
It looks like you've got a nice cup of tea there, so.
Yeah, alhamdulillah. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala ashrafil anbiya'i wal mursaleen. Sayyidina Muhammad wa ala alihi wa ashabihi ajma'in. Jazakumullah khairan everyone for joining us again for a webinar. It's been a while since we spoke, but alhamdulillah, as they say, no news is good news. So it can only be a good thing, alhamdulillah. So over the last few months, alhamdulillah, we've seen the masajid reopen, albeit with some pretty strict conditions in place in order to keep our congregations safe and our staff and our volunteers safe as well. And alhamdulillah, things seem to be going quite smoothly for us, alhamdulillah. And compared to other parts of society which have reopened as well, the masajid and places of worship in general seem to be keeping things in check and things seem to be going quite smoothly for us, alhamdulillah. And that really comes down to the efforts of everyone, from mosque leaders through to the imams and through to the general public as well, and maintaining the key principles of infection control, and also making sure that we're reminding each other to keep these measures in place, and where need be, we're enforcing these measures as well to make sure that people attending the masajid are kept safe, and also our staff, our volunteers, our imams, and everybody else are kept safe as well. We're now in a situation where a few weeks after the masjid's reopening, schools are due to reopen as well, and inevitably the question around reopening maktabs and after school classes was one that we were going to address as well. And many of you were keen to reopen. Many were keen to find out what reopening would look like. And in that regard, we put together some guidance based on our understanding and speaking to some senior ustads in Scotland as well. So alhamdulillah, that guidance came out last week, and we were very keen for those masjids who felt they were ready and able to reopen. Over the last few days, we've seen quite a turn really of circumstances here in Scotland. We were never really out of the danger zone in terms of the ability of this virus to spread and for cases to spike, as we've seen in other parts, in other sectors of society, particularly in Aberdeen, where we saw indoor hospitality the cause of major spikes and a localised lockdown. We've also seen here in the west of Scotland, Glasgow and some parts of Greater Glasgow going into some special measures as well for 2 weeks. and we found out that those measures are going to be extended by another week. Over and above that, in the last yesterday's figures were quite concerning from the Scottish Government. There had been a new positive case of COVID-19 in every healthcare board area on mainland Scotland. So that means everywhere in Scotland on the mainland, there was a new case of COVID-19. Alongside that, there was 3 deaths, which is actually, we're actually at a point now, since May, this is now the highest point of the curve now that we've been at since May. So the way things are going, the way things are looking, it's starting to cause us some concern. Speaking to some of our Muslim healthcare professionals across the country, particularly those who have oversight over the modelling and the COVID-19 figures and are looking forward in terms of planning and things, their outlook just now is pretty grim, to be honest. And I don't say this to be alarmist. I'm passing on really the information that I'm receiving. And what they found is that in other parts of the UK, in some of the cities, they're starting to see the ITU sections of hospitals starting to get more and more COVID patients coming back in. So effectively, at this point in time, we're actually at a bit of a crossroads, and the decisions that we take just now, not just as a community, as masajid, as masjid leaders for our own communities and for our own congregations, but actually as a country, the decisions that we take now really are going to define the next few months in terms of whether we do go into another spike in cases, or whether this is just a resurgence of this virus, or whether it is something a lot more serious, whether it is a second wave, as we've been hearing over the last few months, which is very possible. So really the actions that we take now, the decisions that we take now are going to define what happens in the next few months. Many of you have been in touch to ask also about the cap in numbers in terms of congregational prayer. So I'll just cover that quickly as well. So we have been speaking to the Scottish Government about the cap, about the difficulty that it poses, particularly for masajid compared to other places of worship, because alhamdulillah, on a Friday we do still have quite significant congregation numbers. So the various challenges that the cap poses, and also going forward with the times shortening and eventually with winter time starting as well. So we were very confident that at the end of this review period we would have some good news for you. But again, the mood music has very much changed over the last few days based on what the situation is just now and what it could be going forward. I mean, we're still optimistic that inshallah over the next few days and months, over the next few days and over the next week or two, this might just fizzle out. It might just be a small spike, and we can once again kind of talk about increasing the cap and increasing the numbers. But as things stand, I think with what we're seeing just now and the kind of modelling that's coming from our healthcare professionals, from our own Muslim healthcare professionals as well, I think it might be unlikely that happens, which is quite disappointing given that we had done really well up to this point. So the reason why, so I just thought it'd be important to cover that off because it's a reoccurring question that's coming through. I mean, in terms of why we've come together today is to discuss the possible reopening of madrassahs and the after-school classes, the maktab. So I'm just going to run over some key principles from the guidance that we've issued, and that guidance, as I say, was pulled together from a number of different sources and the information that we'd gathered, and we've tried to put that into something small, concise, and easy to follow, inshallah. So the first thing obviously is to make the decision as to whether you want to reopen or not. And that's going to be guided by the principles of the measures that you're going to have to put in place in order to make sure you can safely reopen. Now, since releasing this document, some of the masajid have taken the decision not to reopen because of the amount of measures and procedures and things that would have to be in place in order for that to happen. And again, that's a very sensible decision. Everybody has to look at their own circumstances and whether it is right for them, whether they can remain safe for staff and for volunteers, as well as being able to keep the children safe and teach within the environment that's going to be created with the different measures that are in place. So the first key point really is making that decision whether you can open or whether you can open safely or not. And the main thing that's going to guide that decision, first and foremost, is going to be a risk assessment. So when we talked about reopening the masajid, the first point that we talked about then was to appoint a COVID safety officer, who in turn would appoint a COVID safety team. So again, reopening the madrasas, that COVID safety officer would be responsible for carrying out a risk assessment for reopening the madrasa and appointing a COVID safety team specifically to deal with the madrasa side of things. The other responsibility of the COVID safety officer and the COVID safety team, or the COVID safety sub-team, would be to train the teachers in infection control procedures. So the same kinds of procedures that we've put in place for reopening the masajid. So that's going to be things like making sure social distancing is carried out, students keeping their possessions with them, keeping their shoes in a bag. Hand hygiene is incredibly important. It's one of the key ways in which we can kill the virus. So making sure that we're sanitizing when we're going in, and at different point, and wherever it's possible, at different points throughout the class, the children are able to wash their hands or able to sanitize their hands. The other thing that the teachers would need to be aware of is are identifying the symptoms of COVID-19. So if they can see symptoms in some of the children, then they'd have to take some action there. The other thing would be updating the class registers that you already have for the children, and updating that with details of their school and also the class that they're in their school as well. So if there is any directive from schools in terms of, like we've seen in Pollock Shields in Glasgow, where there's a specific class in St Albert's Primary that was told to self-isolate, then if the masajid also have that information with their own children, it empowers them to be able to take the necessary steps to keep the other children safe and to keep the staff safe as well. And there's some important learning to take from the schools reopening as well. And again, this is why I'd advised, given what I said at the time was my sincere counsel to the masjids, was to wait at least 4 weeks from the schools reopening to see what plays out in the school environment and see what learning we can take from that, and then apply that in the masjid setting as well. So some key points from the school setting is that adults in a school setting are actually at a higher risk than the children. So teachers, they shouldn't be physically interacting. They should be maintaining social distancing unless it's absolutely necessary. And if they can't maintain the social distance at any point, then they should have face coverings. So, for example, if you're walking down corridors, if you're walking through corridors, if you're using communal areas, make sure you've got a face covering on, and make sure that you are sanitizing your hands as well. So that's a very important piece of learning from the school setting. One thing that has come out from the Scottish Government guidance, which has been reflected in our updated guidance, is actually that all children above 5 need to socially distance. So initially, we'd put in our guidance based on what the understanding was in England, that children under 12 would be able to be in a class and not have to social distance. But actually the directive from the Scottish Government is that all children over 5 need to socially distance. So you would have to take that into account when we talk about the second part of this, which is going to be physically laying out the space. So the second part of this really is how we physically set up the space, how we prepare for everything to reopen. Now, alhamdulillah, we're in a blessed position where we'd really be hitting the ground running in terms of the equipment that we would require to reopen, in terms of PPE and hand sanitizer, floor markings and things like that. So a lot of that the physical preparation material should already be there. So in terms of physically prepping the area, what we're advising is if you're in a situation which most masjids will be in, where they've got one big hall with a number of different classes in there, we would advise that those classes are kept at a distance of 3 meters. Now the reason for that is maktab classes sometimes, especially with younger children, they can be quite active. So there might be children getting up to come to the ustad. They might be coming up to go and speak to another student or something like that. So if there's a situation where students or teachers have to get up and walk around the class, you've still got a 2 meter distance from the other class. So this is why, although social distancing is a minimum of 2 meters, we're advising to keep a minimum of 3 meters, just so we can keep that distance if there is movement in the different classes within that large hall setting. We would also advise that children are split according to age as well. This might cause some issues in terms of classes that are mixed and not generally split in terms of age, particularly your HIFS classes. Where generally it tends to be a mix of ages. So we would advise that children are split into 2 groups, 11 and below and 12 and above. And again, this is based on the risk that the different age groups pose. Younger children seem to be less symptomatic than the older children, which means that they're going to be less of a risk to each other. Older children and young adults especially tend to be a little bit more symptomatic, in which case there's more chance of them spreading the virus or catching the virus because others are spreading it. So this is why we've advised to have that split there. Now, if you're socially distancing and you're splitting classes up, what that's going to mean is that your ability to actually keep children in one place, the number of children you're going to be able to have in one place is going to be very, very drastically reduced. So to cope with that, and also to reduce risk as well, what we're advising is to create class bubbles with a maximum of 10 children in each bubble. So with the bubble, what you're essentially doing is you're kind of grouping children into you're grouping them into a smaller group. So if there is ever, Allah forbid, a spike, or if there is any cases and some of your children are having to self-isolate, if that then has a knock-on effect on the children in the masjid and in the maktab, then it's a small number of children who are affected. And again, it minimises the risk for the ustads as well, in terms of when they're interacting with children and their ability to keep things like hand to keep hand hygiene up, to be able to go away, wash their hands, take a break, and also to give the area a quick wipe down before the next group of children come in. We would also advise, as with in the school setting, that when children are coming or leaving, or when they're in places where it might be difficult to maintain social distancing, like pinch points in corridors, when they're putting their shoes on, taking their shoes off, then to wear face masks at that point. Now, some may choose to have a phased return where children are being brought back, class by class or age by age. In that scenario, again, we would advise that the children who are under 11, their classes come back first. And those who are 12 and over, you'd continue to teach them online until you decide at some point to phase them back in to come into the masjid. So the classes that are either being phased to come back in, or those who are split into bubbles, we would have to reduce the time that they're in the masjid in order to make sure a number of different bubbles can come in, or that the different classes can come and go as well. So, for example, if your normal madrasa time was 5 p.m. to 7 p.m. and your classes are, say, 30 children to a class, you would then cut that down to 3 bubbles of 10. Each class would be in for half an hour, and then you've got time to play with in terms of getting children in and out of the building, and also making sure that you can give the area a quick wipe down before the next class starts. The use of toilets and wudu facilities, again, is restricted. They're only for emergency use. And if in an emergency you do have to use the wudu facilities, then then you would have to clean the toilet after each use. So again, that's something that when we're communicating with parents is going to be very, very important. Can we go to the next slide, Zara? Yeah, so following on from that then, what's going to be critical here is communicating the changes to parents and also communicating the changes to children. So the easiest way to do that again is to have a video walkthrough of what it's going to look like when they come to the masjid, to the maktab, and what to expect. So that's going to involve kind of just I mean, these days you can film these things on smartphones very easily, and just so people know what to expect when they're coming. Social distancing is incredibly important, especially outside at the gates when parents are coming to collect their children or coming to drop their children off. So what we would advise is outside to have clear markings for social distancing, and also to advise the parents as to what you would expect from them in terms of coming and going. And picking their children up and dropping their children off. Because another thing, key learning from schools, is that parents at the gates aren't really adhering to social distancing as much as they should. So this is something that we need to make sure that we're keeping on top of, which probably would involve, if you don't already, having a volunteer or a member of staff outside just to manage the process. Alongside that, teachers and pupils would have to socially distance as well. So that's something that we've already covered. So teachers and students would have to socially distance as well. So the other thing actually that we would need to mention before we go on to the third bit is actually something that I'm quite passionate about at this point in time, based on kind of my own experience as a parent, but also in terms of how we deal with issues that have arisen over lockdown, in terms of children and what they've been through, and their kind of mental and spiritual well-being, having been in lockdown for so long. So this actually places an extra burden on our ustads, and I understand that it's unfair that this is something that's being placed on the ustads' shoulders, but if we have children in our care who are coming to us to learn the deen, then it's incredibly important that we do offer them a little bit of spiritual and emotional support as well. So some things that the ustads need to look out for is changes in behaviour, specifically signs of anxiety, signs of worry within the children. If there's anything that you notice from before they went into lockdown to now, in terms of attitude as well, these are all signs that maybe the children need a little bit extra support, and they might need somebody just to talk through what lockdown has meant, and how they can deal with the different issues that have arisen. One of the things that we would advise is to maybe even give a small presentation to the children about lockdown, about the different issues that they may have faced, kind of issues around why has this happened, how do we deal with it, that kind of thing. So something very light that the children can relate to, and hopefully offer them a kind of spiritual perspective on what's happened, and really just try to get them to connect to something which transcends this physical reality that they've been living in over the last few months. For older children, we would probably be looking at having some kind of session with them where they can openly ask questions that they might not be able to ask children, may not be able to ask their own parents or their teachers at school. And this comes from something that the head teacher at our own madrassah, Hafiz Abdullah Sahab, actually does with the older children. out with COVID, he has a drop-in session during the week. It's an hour during the week where students past and present can come to him and they can ask any question they want, or he'll cover a topic that they might find interesting, and they get this chance really in an informal way just to talk to the Ustad about things that might be burdening them, or issues that they may have, things they don't understand. So I think that's a really powerful way that we can kind of make sure that we're looking after the spiritual needs and the emotional needs of our children as well. Given that this is an extra burden for massages and ustads, it might be something that you will want to link in with local Muslim youth groups in terms of helping to deliver something like that. So that's something that I think it would be important to cover with our kids in terms of dealing with some of the issues that they might have had over the course of lockdown. So finally, what to do if you have a positive case. So again, ustads and the teachers, the volunteers would need to be trained in what the symptoms of COVID-19 are, and if you see them in a student, then immediately you'd have to separate that student from the rest of the class. You'd have to get their parents to come and to pick that child up, and you would need to send the rest of the class home at that point, and perform a clean of the area. That child would need to be tested. If it is a positive case, then those children who are in that bubble, including the teacher, would have to self-isolate for 14 days or book a test and see what the result of that is. If there is a case, as we say, in a school setting or in a different setting where one of the children are affected and they've been told to self-isolate, you may well get a phone call from the NHS, the Track and Protect people, just informing you of that and telling you again that those children who have been in contact would have to self-isolate. So these are things to look out for in terms of if you have a positive case. Now, in terms of the physical area, if you do have a positive case of COVID, or if you have to self-isolate, it's very simply just a case of giving it a clean with everyday disinfectant. Antibacterial disinfectant, cleaning all the areas down, cleaning all the handles down, and giving the carpet a wipe as well. I mean, in terms of wiping down the carpet, that can even be done with warm soapy water. That's what our health and safety professionals who helped us to design the risk assessment. He's actually an inspector also. That's the advice that they've given as well. So it's a wipe down with a cloth which should cover the carpet. One of the things that we've advised to actually mitigate that risk is for children to bring their own musalla or their own mat that they can sit on during the course of the class. And finally, the last point in terms of reducing the risk factor is we've got to make sure that we keep a separation between the madrasa, the maktab, and the congregational prayer as well in the masjid. And this is actually probably going to prove to be one of the more difficult elements of this, especially in terms of managing times, and where salah times jamaat times might clash with maktab times. So this is where you'd probably have to look at scheduling and making sure that the two are kept separate. I mean, if the two are brought together, it's going to affect the cap that you have for congregational prayer, which is capped at 50, and also it increases the risk factor as well of possible transmission to elders, and elders, as we know, are among the high risk category. So it's going to be important that we keep that separation between the maktab, the madrasa, and the congregational prayer. I'm a very strong advocate of making sure that children, when they come to the masjid, that they pray at least one prayer in congregation in the masjid if possible. What we would advise is for that to happen within the class's own bubble if possible. and inshallah that's something that is really beneficial for them. And if they do that in their bubble, inshallah, it still fulfills that part of the mosque experience for them, but at the same time it keeps the distance between the congregational prayer and the maktab as well. So finally, Sister Zara has put up this very short infographic that we've created with the key points on it in a condensed version, which again should inshallah be easy for people to look at and easy to follow, with some key points on it. And with that, inshallah, I'd just open it up to any questions. I mean, I'd like to reiterate again before we go to the questions, the first point that we made at the very start, that the point of going through this guidance is to inform, first and foremost, your decision-making process as to whether you feel it is safe for you to open and whether you can put the necessary measures in place to reopen. And just because we've released guidance, or the fact that the Scottish Government have said that you can reopen, it doesn't necessarily mean that you should reopen, or it's not an instruction to say that you have to reopen either. Each masjid will need to look at their own individual circumstances, look at whether they are able to put the necessary measures in place and to keep the children, the ustads, the imams, the volunteers all safe from this virus. Jazakallah khair.
Jazakallah, Brother Umar, for that very thorough and informative chat there. So we really appreciate that. We have a few questions from the chat. The first one, Umar, the first two I think have been answered, but maybe we can just quickly go through them again. Do students have to distance themselves from the musallis attending the masjid for salah? I.e., would they be required to perform salah? So you have answered that one.
So
already.
Just to reiterate that again, anybody over 5 years old has to socially distance. We would advise that you try to keep the maktab, madrassah classes and the congregational prayer completely separate, because that's going to affect your numbers for congregational prayer in terms of the cap, but also in keeping the two together increases the risk of transmission to the elders from children.
Okay, excellent. The second question, another good question from the same brother in Lanarkshire, must be the name, Asim, must be a good question to the guy. The second question, in the unlikely event of a case at the maktab, would it also impact the masajid due to the shared space?
It shouldn't impact the masjid in terms of the shared space. It would impact the people who have been in contact with the child. So that would be the teacher, it would be the children in their bubble. And this is why I think it's, where possible, you should split the kids into smaller bubbles to make sure that the impact of Allah forbid, a positive case, it doesn't spread that far. In terms of the physical area itself, the advice that we've had from our health and safety team, but also based on what it says, what the Scottish Government have said as well, is that the area would need to be cleaned. Once the area has had a clean, it's able to be reused again. And again, cleaning is pretty simple. It's a wipe down of all surfaces. It's a kind of a clean of the carpet as well. And again, it's nothing fancy that you need to use. It's just disinfectant that you'd use in your own house, antibacterial disinfectant that you'd probably have in the masjid anyway. And it's a case of making sure that that the areas are cleaned with that, and then it's prepped and ready to use again.
Excellent, that's super. And the third question, which I don't think we'll have an answer to, but we'll ask you anyway. When does MCS, Muslim Council of Scotland, anticipate the Scottish Government moving to phase 4? I don't think there's going to be an answer to that one, but have you heard it from your sources? Okay,
so in terms of moving to phase 4, the Scottish Government has kicked that into the long grass. I think that's probably the best way to put it. Yeah. That's why we're seeing kind of different things opening up in phase 3, which we might not necessarily have seen opening up in phase 3. Because phase 4 is going to be delayed. And when you look at what's happened with some of the kind of different parts of the economy and different parts of society reopening, I think it makes sense for phase 4 to be delayed. And now what's happened over the last kind of few days with this kind of increase in cases again, and we've seen new positive cases in every part of the country. It's going to be important that we try and contain the spread now. So what that might mean is that we probably might not go into a full lockdown like we did at the start of the pandemic. But what we're probably going to see is like a whack-a-mole approach, where wherever this virus kind of rears its head, there's going to be a localized lockdown, similar to Glasgow, similar to Aberdeen, to try and contain it that way. So what that might mean is that we won't see a big steep curve in terms of an increase in cases, but we might see a kind of a less steep curve, but a longer curve, which means it might go on for a longer period of time. So on that basis, I think phase 4 is still quite a while away. But what we need to be doing is making sure we've got all the measures in place, that we're keeping everyone safe, that we're keeping the rate of transmission down, and on that basis, we're able to then put our case to the Scottish Government for more concessions for our masajid.
Jazakallah for that answer. We've got a question from Ustada Khatija. Assalamu alaikum, Ustada. The question is, when do the government recommend opening the madrassas, and what do we do with the alim classes and alima classes that last for 2 hours or 1.5 classes?
So the maktab classes for children were able to reopen from the 31st of August. In terms of adult classes and various other activities, again, there's still something of a limit on that. We would advise that if you're able to continue these classes virtually, then to make sure that happens. If you do have to meet with your ustad, then there is some rules on kind of meeting indoors, which you can under which you can still meet. But the numbers there are very, very low, and again, it would only be in an absolutely necessary kind of situation. In places like Glasgow and Aberdeen, where there's been localized lockdown, there's been no meeting in terms of at other people's houses or anything like that. So I think if you're able to continue the classes online, they should continue online. I will double check in terms of the numbers, and I will get back to you on that in terms of the exact numbers. I can't, off the top of my head, I can't remember what the numbers were, but I'll double check the numbers, and we'll send out an answer to that, inshallah.
Jazakallah. I've got 2 questions. I'll just ask you both. One is from Adam. Should the risk assessment be shared with parents like it was done in schools? And the second question from my namesake again in Lanarkshire. Can we have a copy of the risk assessment from MCS? I'm sure the risk assessment was sent out on a MailChimp last week. But if you've not received it, if you could email info@mcscotland.org, or just go onto the website and the contact details will be there, and Zara will send it over to you, which is much easier. So that one, Asim in Lanarkshire, copy of the risk assessment, just email in info@mcscotland.org and they'll get sent back to you. Naveed, Assalamu alaikum, it's Naveed here from the land of the sheep. I think that's Aberdeen. Have any of the masjid opened their madrassas and that are able to share their experiences? If you've heard anything about that, would be great. Of any madrassas that have opened and have shared their experiences with you.
Sure. So what was Brother Adam's question again, sorry?
Should the risk assessment be shared with the parents like it was done with schools?
Okay. So Brother Adam's question first in terms of risk assessments. Some of the local authorities down south have asked places of worship to publish the risk assessments. So sharing it with the parents of students, as has been done in schools, it's up to yourself whether you want to do that or not. It might be good in terms of inspiring confidence within the parents if they're unsure about whether to bring the children back to classes or not, in a situation where the masjids have deemed it safe for classes to restart. So you might want to either publish the risk assessment or make it available to the parents if that inspires confidence in them to bring the children back where you've deemed it safe for them to come back. Sorry, I can't read my own writing here. What was Brother Naveed's question again?
He's asking if any masjids have opened their madrasa,
If
and if they have any experiences to share.
Yeah, so there was a couple of masjids who were going to reopen basically as soon as the government gave the go-ahead, but they put that to the back burner based on the advice that we'd given, I think, which is sensible to see what pans out in the school environment. So I don't know of anybody just now who's reopened their classes. I don't know of anybody who's reopened in Scotland. Madrassah Talim al-Islam in Glasgow, we're looking to reopen on the 14th of September. Based on what's happened recently, that's probably going to be under review as well. And I don't know of any other masjids who have given dates specifically for reopening. Those who were keen to reopen as soon as we had the green light, as I say, they pushed back their dates for that to see what pans out in the school environment, which was a very sensible thing to do. And I think even just now, we need to have a look at what the situation is and really think about whether it is safe to reopen and whether we can manage that separation between the congregation and the masjid, the maktab, effectively, so that there isn't any risk of transmission to elders or to adults. Adults still remain the higher risk in terms of contracting this virus, so it's going to be important that we can keep that distinction. But I don't know of anybody who's reopened.
I haven't heard of anyone reopening either the madrasa classes. So it's a question, unfortunately, that is not one that we can answer. I don't think even on the MCS affiliates page, a few people were having conversations today with the committee groups and parents about reopening. So I don't think anybody is open yet, and if they have, it's a very tentative opening. Have we had any questions? Any other questions that anyone would like to ask? You can unmute the mic and ask if you would wish.
Assalamu alaikum.
Welcome, Salam.
So I just wanted to ask if a parent has not heard from their madrasa, should they assume that their madrasa will not be opening?
Yeah, I mean, as things stand, madrasas haven't reopened, so they should assume that the madrasa hasn't reopened until they've been told otherwise. I mean, the best thing to do is, if you're unsure, is really just to contact the madrasa itself and then just double check with them as to what the plan is.
So I'm not meaning to start anything here or target anyone in specific, but my kids attend madrasa on Nisdale Road, which I know that Omar, you're a committee member of.
Yeah.
And they've been online since lockdown. And alhamdulillah, it's gone, although it was complicated at first, but the kids managed to get on and read successfully.
MashaAllah.
And it was good, but there was no communication with the parents. And now, in the last week, everything, the kids are saying that the madrasa is due to open on the 14th, and they are there's no information given to the kids, who are reading from the age of 5 right up to the age of 18, who attend that mosque. They are being told that they will be returning, but when my son asked, will this be told to our parents, who are indeed right to question and right to hear first, who should get the information and not the kids? Because in a school, you wouldn't tell your son to go home and say, okay, we're open, school's closed tomorrow. a letter or an email or some sort of communication would be between the parent and madrasa for that to happen. So when I phoned up, I'm not going to mention who I phoned, who I managed to speak to, I was told in detail what was the planned reopening. We told we open from the 14th, and all classes will come back and times will be split from 5 to 5:45, then from 6 to 7 o'clock. And I was told that there will be also the Al school is there as well. So when I asked about the question, will the school be cleaned? And I'm not going to mention a name, but I'm sure you know.
Adam, can I interrupt? Sorry to interrupt, Adam.
Yeah, I'm happy to take this up in a personal note.
Okay, I was going to
because
say,
I
could
have
you
complained about this so many times, and the
could you
parents, and the lack
contact?
of cleaning in that place, in that
Could you
specific madrasa is horrific.
Could you maybe contact Omar directly himself rather than discussing on the forum here?
Yeah,
If
I'm
that'd
happy
be okay.
to do that if I could get a
Yeah.
contact detail
Okay.
for him.
Yeah, that's fine.
Because I was told there'll be no disinfecting in that place. I was told from this very high source to be no, I don't think there'll be a disinfecting.
Okay, so what to do is if you email in the page on the website, you'll find the contact details and Omar will get in contact with you then. If you leave your number, if you email in and leave your number, he can contact you from there.
That's
It's
fine.
info@MC Scotland. It's in the chat. You'll see the email address.
That's fine. As I say, I wasn't meaning to start anything here, but
that's okay.
it's,
that's all right. It's best. That's
once I
a
explain
private
for
thing between the masjid and yourself, rather than MCS. Okay. Okay, so we're going to wrap up just now. I don't think there are any more questions left. If anyone else has a question relating to the opening of the madrasas.
Yes, Asim, we've just got a few questions come in.
Okay.
What is the role of parents in managing this process, and should mosques consider doing maybe a pilot run first, just to kind of review how things are?
Yeah, so a pilot run would be a good idea to see how it goes. One of the masjids that was wanting to open from the get-go, they were going to be doing like a phased return, so it'd be one class and then a second class, like that, just to see how it goes, how the system works, and what kind of learning they can take from that before they actually open it out to the rest of the classes. So it would make sense for something like that to happen, just so the teachers can get comfortable and the pupils can get comfortable with with the system, and we can see how it goes. In terms of the role of parents, as I say, the learning from schools has been that parents at the gates haven't really been maintaining social distancing, and unfortunately that will probably happen in the masjid environment as well. So it's going to be important that we reiterate to the parents that they've got a duty as well to maintain social distancing outside. We'd also have to make sure, as Brother Adam pointed out rightly, masajid need to be communicating with the parents, and if that's not happening, then we're going to get a situation like the one Brother Adam's just described there. So it's going to be important that there's communication between the masjid and the parents, and conversely the parents communicate with the masjid as well, particularly if they hear of if their child has been in a situation in school where they've been told they have to self-isolate, or if they've been in contact with somebody else who is self-isolating. So it's important that the masjid gets that information as quickly and as timelessly as possible. And finally, the other thing is that the children, because they're going to be coming for a reduced period of for a reduced time than what they're used to, it's incredibly important that children are prepared when they come to masjid, prepared in terms of the work that they're doing, but also prepared with all the necessary measures, whether that's a face mask, whether that's making sure that they've got their hand sanitizer with them, or their mat to sit on, that kind of thing. So it's going to be everybody really has to chip in here and make sure that they're fulfilling their obligation to make sure everyone's kept safe.
Okay. Zara, you had another question?
Yeah,
there?
we just got one. Can students use the toilets as younger children tend to go to the toilet more? And there's just a comment here from Brother Naveed. A suggestion made from someone to our masjid was to invite our local authority to come and review our policy and procedures in place. Not sure if this is worth sharing as we are considering this. So I guess that one on just the use of, obviously younger children will need to go to the bathroom more.
Yeah, again, I mean the directive that we've got from the Scottish Government, and it's in their guidance that we shared the link for as well. It basically says that the use of toilets is for emergency use only. I have asked the question and I'm waiting for a response from them in terms of what that means for the ablution area, the wudu area, because their guidance was specifically for toilets. So we're still waiting on an answer from that. But in terms of using the toilets, it would only be for emergencies, and after each use, it would have to be cleaned.
That's super. Any other questions you've had come in, Zara?
Assalamu alaikum wa rahmatullah.
Walaikum assalam. Who's that? Is that Brother Shiraz?
Brother, yeah, it's Shiraz from Falkirk Islamic Centre. My question is, Alhamdulillah. My question is, see, I'm not really sure, what is the turnaround time if you have a positive case? Normally, how long does it take for the child to go and get tested and get the results? You know, if we had a positive case, if we have to get in touch with that bubble of students, just so that we have a turnaround time.
Well, I mean, in terms of somebody getting tested, it really depends on where you are and how busy it is. I mean, there's been a case in, for example, my child's school, but the child actually got tested the next day after booking an appointment. So it was on the Sunday that they thought they had symptoms. The Monday they got tested, and on the I think it was might even have been that same day, or it was the next day. The latest, it was the next day that they got the result back to say that it was negative. But that's going to vary depending on where you are and how busy the test stations are. But normally, it's usually a couple of days from booking the test to getting tested and then getting your results back as well.
So if that child, just say, for example, he's coming to the masjid on a Monday, how long roughly does it take for the symptoms to start showing? And in that time, and even though he's coming in the bubbles, we don't know how many people he's been in touch. We might have an idea inside the masjid, but if the parents are outside the masjid, obviously that's educating the parents as well, waiting for the children.
Absolutely, yes. Yeah. So the way it basically works is that NHS Track and Protect, their team would step in, and the masjid would pass their the information over to the Track and Protect team in terms of who the child has been in contact with, and then they would basically take it from there. This is why it's incredibly important that the parents are maintaining social distancing as well at the gates, because if, Allah forbid, there is a case and the parents have been kind of mixing freely outside, then there's a very real chance that they will be spreading the virus if they're not socially distancing.
I think that's time up for us, and I think that's all the questions that have been asked, and Omar has very thankfully answered them all. Could I just very quickly ask Dr. Habib to finish with a concluding dua, and we can wrap up from there. If you just unmute yourself, Dr. Habib.
اللهم صل على سيدنا محمد وعلى آله وصحبه وبارك وسلم. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وقنا عذاب القبر وقنا عذاب الحشر وقنا عذاب الفقر وقنا عذاب الميزان. ربنا تقبل منا إنك أنت السميع العليم وتب علينا إنك أنت التواب الرحيم. صلى الله تعالى على خير خلق محمد وعلى آله وصحبه وبارك.
Exactly, Dr. Habib. A couple of things just to conclude on. All the resources will be on our website. It's a new website. It's www.mcscotland.org. That's www.mcscotland.org, and they'll be under the resources tab. You'll see it there. If you do have any questions that you would like to ask, the email address is also on the website. It's info@mcscotland.org. That's info@mcscotland.org. They're both on the chat, if you can see the chat in the bottom right-hand side. The link for the risk assessment will also be there, but it's also in the chat if anybody wants to use that. And one other link was the Scottish Government guidelines on opening madrassas and classes. And I think that's us all ready. Any other thing to add, Sarah? Are you okay with that?
Yeah, no, that's great. Thank you so much, everyone, for joining us.
Everybody.
And inshallah, if you do have any further questions, let us know. And thank you, Omar, for facilitating a really comprehensive discussion. And as everyone is aware, this is an ongoing conversation. So we'll keep you all posted as best we can. Okay, everyone. Assalamu alaikum.
Assalamu alaikum.